Hello, I'm Russell Simpson, Executive Director for Allied Health Scientific and Technical, Wairarapa and Hutt Valley District Health Boards. Over the past week we've been running demonstrations of telehealth to look at how we can improve our patient care and experience across the 3 district health boards. We've had over 200 staff members attend the rolling demonstrations across the 3 sites, and we're about to provide a presentation for you on the use of telehealth and video technology across our healthcare system for those who couldn't make it during the demonstrations. So look forward to having a look and discussing with you the options following the demonstrations on how we can improve the health outcomes for our population.
Hi, I'm Jason Tomasese from Cisco.
Hi, I'm Susan Philp from Genome. Over the last week we've been showcasing video conferencing technologies across the 3 DHBs in Wellington.
We are not trained medical professionals, but over the next 3 minutes you'll show examples of what we've been demonstrating to clinicians throughout the area of how video technology could complement patient healthcare today. Right now I'm at the patient's bedside. This is Bob, who's been in an accident and is unconscious. And what we're able to do is we're able to bring in a doctor at a remote location. In this case, we're showcasing Wellington Hospital, Wellington ICU. So I'm going to place a call through to Dr. Susan Phillips, who happens to be in Wellington. And if she answers the call, she can get a direct view of what's happening with our critical patient here. She's got control of the camera so that she can pan in and tilt and zoom the camera so that I can have, my hands free. I'm not having to bring in and control some extra technology. Susan's an extra eyes and ears on what's happening in this patient case. Now, beyond just Susan having access to what I can see from the main camera here, we can connect other types of clinical imaging systems which may be available. We've borrowed this particular camera called the horoscope. It's got a general exam camera. If I had, for example, a burns victim, which this camera didn't have a good view, I could send through to Susan this extra camera image at the very same time. I could get a closer view of that patient and send it through. In this case, I'm going to use myself as an eye injury, and I can send through very detailed information from this extra camera that Susan then can see on her screen as if she was standing next to me. Another example, if I needed access to an ear, nose and throat specialist, an ENT specialist, we can attach a endoscope. So I'm just going to send through an image of my inner ear, and if I had an ear infection, then Susan could also see that kind of information. So we're complementing not only the face-to-face kind of discussion, I'm sending in any other bits of information I've got from clinical cameras. Another example is just something that we've been during our spare time here. We're looking at existing equipment. This is a sonocyte ultrasound. I'm using the same type of cable that you'd see at home connected to your television. So I'm taking the output from the ultrasound and I'm now going to send through to Susan that image so I could be guided real time by a specialist at another location. That ultrasound image is being sent while I'm in consultation with Susan at the other end. Also telemetry information. So Susan can also monitor, particularly in a critical case, the vital signs of that patient and what's being sent through. This unit here is fully mobile, so it's got its own battery supply. It lasts for about 3 hours before it needs recharging, connects wirelessly through the Wi-Fi network. So the great thing is that this can be taken patient bedside. It's designed to be in a clinical environment. It can be locked down with the wheels. It can be washed with the same hygienic solutions that you use for other medical equipment in the ICU, and it's very easy to use. One other thing that I've got here to show you is an electronic stethoscope. So just more information that I could send through to Susan, where I could send through the patient's heart and lung sounds so that she can make a better diagnosis, because that's where the specialty lies. Here in Wellington we have Dr. Susan Phillips, who has been reviewing this case. But she may want to bring in another specialist who's not actually in the ICU in Wellington and maybe on call or another part of the hospital. So I'll get Susan to call Dr. Kevin O'Connor, who's going to answer on an iPad. Very easy to use touch panel. She's able to find Dr. O'Connor's details and just click call. So during the call that we've got going through to Masterton, Dr. O'Connor has answered on his iPad from his living room. He gets exactly the same information that Susan is looking at, exactly the same time. You can see the patient bedside in the Wairarapa ICU. Today, anything that has a device that has a camera and has a network connection can participate in the same experience that you've seen earlier, with Susan using one of these units, a 23-inch screen, which is able to communicate over video, or whether it be the specialist clinical card. This is where the telephone has evolved to today. The telephone for many decades has not changed, but now we've brought together the smartphone, the tablet, video and audio all into one package. This can reside in somebody's desk within a hospital environment in their office, but also could be equally used at home as a device for when you're on call. One other exciting example is where patients could use a device like this for post-operative care or palliative care. So as you can see, exactly the same imagery that's been available on all the other devices now comes through to the smart desk phone, which has now been available for several months. I've connected the smart desk phone to an external monitor, so if I need a larger image than what's shown on the 7-inch screen here, I can connect it via an HDMI cable to a larger screen. Because it's a smart desk phone, it also runs Android, and so you can get access to Citrix desktops, you can check your email, your calendar. A common starting point though for video communications, as you've seen here, is just repurposing existing computing devices. May have laptops and PCs, often they have their own inbuilt camera. In this case, I've attached an external camera because it has great optical lens. Very, very engaging. I've called through to what traditionally is just a room-based video endpoint, but as you can see, the video conversation has expanded way beyond what's been available for several years now, but the quality is the high definition that we've come to expect. And what you're seeing here is a ruggedized video endpoint. This has been designed for military specifications. It's dust-proof, water-resistant, can be dropped from 3 stories and it's not going to break. Lots of uses for this, whether it be in patient transport in the back of an ambulance or in a helicopter, or whether it be in a disaster zone where there's an earthquake. You can actually have clinicians in the hospital with a real-time view of maybe a crush victim happening on site and guiding through those emergency personnel into what to do.
Well, thank you for watching. I hope you've enjoyed the demonstration that we have just provided. This is about improving patient outcomes, it's about improving the clinical experience, and it's about access to the right person at the right time for our population. So I look forward to many conversations with you on how we can progress the use of this technology, and our next steps are to look at using telehealth across our high dependency unit in the Wairarapa, ICU at Hutt Valley DHB and ICU at Capital and Coast. Thank you very much.